This is what Dr. Roger Nebo calls the opening gambit. Hello, have you ever noticed how patients begin their consultations with a doctor? Usually with carefully chosen phrases, something like, "Is this stomach ache, doctor?" Or, "I hope I'm not wasting your time." But these are not just casual openers. This is what Dr. Roger Nebo calls the opening gambit. So in today's video, we'll be diving into why this first line matters so much and how it can shape your entire consultation. And of course, why ignoring it would cost you a whole lot, especially for those preparing for any form of any exams or clinical exams, I mean. So if you're a medical student, GP trainee, or any doctor preparing for any clinical assessment exams, or you're just curious about clinical communication, please hit that like button, subscribe, and let's get into it. So, question is, what is opening gambit? This is an initial step a patient will make when they walk into your consultation room, okay, or even if telephone conversation. Oftentimes, this is rehearsed in their minds and it reflects their position, their concerns, and their emotional states. I'll give you a few examples. One, patient might say, "There's something that's bothering me, doctor." This should be a quick one for you, doctor. "I think I'm pregnant. I actually do have a list of problems. You rang me though." So these are just but a few. But why does all this matter? As a clinician, especially in general practice, the opening gambit is very important and sometimes accompanied with what we call a curtain raiser, which is an unscripted remark. Patient might come into the consultation room for something different, like say repeat prescriptions, and they mention, "Doctor, now that I'm here, I was just wondering, what they're wondering about. It's possible they have like a long, persistent cough, or they might make a general comment about their life. For example, "Doctor, I've just been so busy with my elderly father these days, and now this." So this phrase often reveals a whole lot, and the patient's, agenda is one of it. Some of them might be hidden concerns, their emotional tone, and of course their expectation. Also, it reveals some cues that can help you with your diagnosis, your management, and your rapport. Dr. Nebo also emphasized that this gambit could give you almost all the information you need if you listen carefully. And so I would ask, how would you respond to this? So there are 4 tips that good candidates, good doctors use, to be able to respond when patients bring up these opening phrases. One, acknowledge and validate. Okay, really, can I just ask a few questions about what's been going on? Number, show empathy. "I'm so sorry to hear that you are still struggling with your symptoms, your headache, your chest pain, or whatever it might be. We are certainly here to address those concerns that you might have." Number three, invite the story. "Please, can you tell me a little bit more, about how this all started or what's been going on?" Okay, it shows that you are interested in that conversation. And lastly, active listening. Okay, echo the patient's word back to them. Have an open body posture and encourage them to speak more. And also, avoid interruptions. Many candidates miss these vital moments. They just go in straight into history taking management without acknowledging this patient's opening line. Okay, and if you don't do that, what it will cause it will lead to disjointed consultation, poor management, you might miss the cues, and of course poor interpersonal skills, and ultimately you could fail your exams. All right, and in real life it's even worse because what happens is it damages the therapeutic relationship you have with your patient and erodes trust. So next time you hear a patient say, "I hope I'm not wasting your time, doctor," give it a pause. That's not a passing statement. That is an opening gambit. Listen to it, validate it, and that will guide your consultation. So if this video has helped you rethink your approach, patient's opening, statement, hit that like button, subscribe, and drop a comment, especially what is the most memorable opening gambit you've heard in practice. Thanks for watching, and remember, great consultation starts with great listening. I'll see you in the next video. Take care.